Good morning, everybody, and thank you for joining us today at the Greater Langley Chamber of Commerce. We are speaking this morning about mental health and leadership and mental health in the workplace. And it's my pleasure to thank Michael Anhorn. He is the Executive Director of the Canadian Mental Health Association for the Vancouver-Fraser branch. I would like to take this moment to acknowledge that we are meeting virtually today on the unceded territories of the Coast Salish people. And Michael, I'm just going to go into your bio for a few minutes. He has significant experience in disaster response, change management, not-for-profit governance, leadership development, government relations, program development and evaluation, and policy development. A fellow policy wonk, I love those. Michael has spent over 20 years working in the non-for-profit sector, and for the last 7, he's been leading the CMHA Vancouver-Fraser branch as the executive director. And since joining them, he has led the amalgamation of 3 formerly independent CMHA branches, oversaw preparation of the branch's first accreditation survey with the Council of Accreditation of Rehabilitation Facilities, and has grown annual revenues and associated services by 35%. You can now add that you have also survived and developed new programs during a pandemic, including a significant increase in both private fundraising revenue and earned revenue. Michael is passionate about helping people live more healthy, mentally healthy lives and creating an inclusive society, growing the role of peers and delivering of mental health services, and ensuring that the nonprofit sector in general, and specifically CMHA, has the leadership and governance capacity it needs to support people in our communities. Michael, thank you so much for joining us today. We really, really appreciate you coming out.
Well, thank you, and thank you for having me. It's a real honor to be here, and hope that it's helpful for the people that have joined us and for the chamber itself.
And for those that decide to watch the recording later, that is one of the things that we do here, is we are recording everything and letting people their ability to watch it later when they have an opportunity. So again, thank you. Did you want to give us a bit of information about what you and your organization are up to right now, and then we can jump into some of the questions?
Sure. Yeah, the last few months have been quite a challenge, but we very early on in the response to the pandemic, we realized the importance of mental health and mental health supports. And so we took all of our programming, almost all of which was in person, and found ways to do it over the phone and through other virtual technologies like Zoom and other video conferencing and some chat. And I think even some gaming platforms for some of our younger program participants. And so all of our programs except one school-based program continue to operate. We continue to provide support for people recovering from serious mental illness to make sure that they continue to integrate into their community and employment. We provide support for people not living with mental illness to live more mentally healthy lives. And that actually has ramped up quite a bit. The province has helped fund increases in programs like Bounce Back and Living Life to the Full, which help people to deal with stress in everyday life and deal with stress in the midst of a pandemic. And then we also do a lot of work with workplaces to help managers and employees know how to have conversations with one another about mental health that are supportive in nature, and also to help know when they need to enter into those conversations that are related to accommodation and how to make that transition smoothly and supportively for the employee. Yeah, so that's the majority of the work we do. And like I said, all of it is still ongoing in the middle of a pandemic response. It definitely looks different than it did 3 months ago. And I think looks different than we thought it ever would. But such is the nature of a response to a crisis. And so, yeah, that's the scene.
In my experience, I've, as I was mentioning to you prior to us getting started, I have had the pleasure of working with your organization and bringing mental health awareness to the workplace, and bringing out your program, Mental Health in the Workplace, is very well established and works great. And I do highly recommend that some log into your website, check it out, and find some more information, especially if you're in a leadership position or are looking for some assistance through the programs. Michael's definitely, your organization's definitely the go-to. So I would recommend that everybody follow up on that if you have an opportunity. With that, let's jump into some of the questions.
Great.
So now, question number 1, and I think this is probably the number 1 question on everybody's mind. How can I monitor my own mental health?
Hmm.
especially during, and let's take it into the context of everything that we're talking about is present day,
Yeah,
COVID.
during a crisis response or during the response to the pandemic.
Right.
Yeah, this is a great question, and I'm glad we're starting with it because all mental health starts with ourselves, and then as leaders, hopefully, if we're taking care of our mental health, we can support the people we're providing leadership to and with to support theirs. So the first thing to look for is changes in your behavior. If you're normally really outgoing and suddenly you don't want to talk to anyone, that's something to pay attention to. It may not be concerning if it only lasts a day or two, but if it lasts a week or 2 weeks, then that's something that I'd be concerned about. And vice versa. If you're normally really quiet and reserved and don't need to talk to a lot of people, and suddenly you find yourself on like needing video call connections or phone call connections and being more extroverted, that's a change in behavior. And so any kind of change in behavior, if you're drinking more than you used to for a sustained period of time, again, may not be something to worry about, but it's something to notice, right? So noticing changes in our behavior is one of the ways to monitor our mental health, mental wellness. And then also monitoring our internal conversations. So most of us, and for myself, I rethink things. I have conversations in my head ahead of time. That's for me fairly normal. But if the tone or tenor of those conversations change, if you notice that they're getting more negative, if they're making everything into a really big problem, that's a kind of change that I would start to be concerned about. And again, we all have bad days, right? But it's when those bad days turn into bad weeks or bad couple of weeks that that's when it gets more concerning. And I want to talk for a minute about the natural flow of emotions during a crisis. As was mentioned, I worked both as a staff person and a volunteer for the Canadian Red Cross for many years. And so was involved in many disaster responses. And at the time, I did not think I would ever be in a disaster like the one we're going through now. But one of the things I learned in that is that even if you're not directly affected by the disaster, if you're just there as a volunteer responding to help and support, there's a natural wave of emotions where sometimes you have good days, sometimes you have even days, and sometimes you have bad days. And it's a bit of a roller coaster. They talk about it as a roller coaster disaster response. And one of the things I learned in disaster response was you kind of just need to ride the roller coaster. You're not going to get rid of the lows. You're not going to get rid of the highs. It's just going to happen. Where we get concerned is if you get stuck in a low or if you get stuck in a high, right? That's where it gets more concerning. So moments of bad mood, moments of lack of impatience, moments of euphoria, those are all just part of the natural human condition in a disaster or crisis response, and probably in any time, but we're more aware of them in the crisis response. And so, yeah, it's that extended time in one or the other that's most concerning. Yeah, so I hope that helps to answer the question and give some people some tips about what to look for.
I do, and in the part follow up to the question was what's healthy in this situation and what's concerning, and I think you touched on a lot of that. I know for myself, the decision to cancel major events and shut the doors and move everybody remotely, I got home and went, what am I doing? Like how, okay, sit down, write the plan, sort of get into those things. And I think the roller coaster is a perfect description of you do this for a few, especially the even first initial week or two. I think it was, fight or flight kicks in. And so you're like, okay, hunker down and get this done. And I think part of it right now for a lot of people, what I'm finding in conversations is the unknown.
Yes.
The unable to, so for instance, a conversation I had yesterday with somebody was, I don't know what September looks like. And I said, okay, we can't change what September looks like now because we don't know, we're not there yet. So how about we deal with this week?
Yeah. Yeah.
Instead of anxiety on what's to come and looking forward to it, stick to what you know right now and deal with the known around. And I think, I don't know if I was great advice, but it was kind of a, let's deal with what we can handle and we will deal with that when it comes up.
Yeah. No, I do think that's great advice. The reality in a disaster is everything we thought we know, we no longer know, right? There's been a lot of talk of the new normal. And the reality is the world is going to change. What we don't know is how yet. And that, for many leaders, myself included, is really difficult because we're used to looking up to be 6 months, a year, 3 years, 5 years ahead, right? That's our jobs in many ways as leaders. And in a disaster, that's not possible. You can try, but it's going to lead to like seeing nothing but fog and uncertainty. And it's probably not going to serve you well. And it's probably not actually going to serve your organization well in the short term. And that's another piece of responding to a disaster is you go from long term to just make the decision you can make right now with the information you have and be open to it being wrong tomorrow. Because decisions that are right today, we might get a new piece of information tomorrow that makes us go, oh, no, we can't keep doing that. And again, that's a natural part of responding to a disaster. When the whole world gets turned upside down, we no longer know what cause and effect relationships are, right? Or what, and sometimes they totally change on us, invert on us. And so we make the best decision we can in the moment. And then when we have new information, we need to be open and willing to remake those decisions. I talk about it as not getting married to my decisions during a disaster. Like in regular times, we can, set a direction, really get behind it, get motivated, stay aligned to it and go, right? In a disaster, you can do that until you've got a new piece of information. And then you need to be willing to say, oh, okay, how does that impact what we've decided? Now let's adjust and go again. And in a disaster, you can't wait to have all the information to make a decision.
Yeah. And that can be stressful for your teams as well, in that you're, as a leader, you're trying to set, here's the plan for the next 3 months. And like you say, I think everything I've done lately, I put the caveat as this could change at any moment, depending on new information, whether it be from Dr. Bonnie or somebody else. So.
Yeah, and I think it's really important to be transparent with your team about that. That can help make it easier. Like if your team knows and trusts that you are making the best decision you can today based on the information that we have today, and that new information will be coming regularly. One of the things I talked about with our team was that we're in a period of unknowing, of uncertainty and unknowing. And that although it's hard, it is okay to be in that space. We've all been in that space before, and we may like it more or less than others around us, but we know we'll come through it, right? And so to provide some reassurance of that, be explicit about it. People aren't necessarily looking for definitive answers, but they are looking for confidence that you're willing to keep making the decision. So if you can't make a final decision, as long as they know that you have their best interests in mind and you're doing the best you can with the information you have, in my experience, especially in a disaster response as opposed to recovery phase, people are very willing to give you that latitude to make decisions as they're needed and to make course corrections as they're needed. And we will talk a little later about the difference between response in a disaster time and recovery. They're actually two overlapping phases, but they're two different phases, and people's responses are different in them. So.
Definitely. So we you started covering off on what, next question is, what are two of the most beneficial acts a leader can do to help their team through this time? And as you just said, one is the confidence and in making decisions and the transparency. Any other words of wisdom?
I think the other thing, and this came or was one of our staff people helped me see this, and that's that people need to know you're in it with them as a leader. And so if you don't want to overshare and make your team be your support, but they at the same time you need to share enough so that they know that this is hard for you too, that you and your family are struggling to work it out, so that the saying "we're in this together, all together" has been used a lot in this response, and I think that's really intentional. And needs to come from us as organizational leaders as well, so that our teams know we really are all in this. None of us get to sit up on a mountaintop and escape. And I think sometimes as leaders we're trained to not show that, right? To not show our vulnerabilities. I think it's always important to show some level of vulnerability so that people know you're human and can connect to you. Our titles are scary often to people, and that's one way to help break those down and remind people we're human. But in disaster response, crisis response times, I think that's even more important. And to acknowledge what you're going through and acknowledge what your team is going through, to really build that connection, and to be willing and able to have those conversations. I know many of our staff had kids at home unexpectedly and suddenly, and they were at home unexpectedly and suddenly. Managing that, I don't have children myself. I'm not sure how the parents on our staff team did that. I could barely manage, and I have my dog and myself in my house. Pretty easy household, right? And so I've acknowledged that to our staff team that I don't know how they've done it, and that I'm so appreciative they've done it. So I think those are probably two, not maybe the most beneficial, but they are some of the most beneficial.
Great. So one of the questions was, somebody was asking if they were very interested in how to support their frontline staff. So you look at a lot of the nonprofits in our community are right in the thick of it. They're running seniors facilities, they're feeding the homeless, they're doing all of the things in our community that they still need to do, but now they're doing them through a pandemic with restrictions in place and protecting their own teams and the frontline, the people in the community that need their help. So how to support the frontline staff and other staff impacted by COVID-19. But on top of it, now the tragic events in the US and related to racism and inequality has sort of added another layer to, let's say, the stress of the situation. And so I'm looking for some words of wisdom on support for those people.
Yeah, so, and I do want to acknowledge we're in a time, we were already in a very stressful time. And we're in a time now where I think the impacts of racism are more obvious to more of us. And I want to be careful how I say that, because it's not that racism is worse now than it was 5-10 days ago, but more people are aware of it. And people who are often racialized or discriminated against are now probably also having to answer more questions, or are getting more questions from people about their lived experience. But it's not a lived experience that's changed overnight. What's changed is society's awareness. So I want to be careful about not putting more stress on people of color and Indigenous people than already exists. Want to express support. And I would say this is true for both frontline people working on COVID, as well as now in this time where our awareness of the impacts of racism are heightened. We want to express support for the staff and appreciation for the work they've done in incredibly difficult circumstances. And, I had a supervisor many years ago who said, you cannot underestimate the power of the words thank you. And it sounds simple, or at least to my brain, sometimes that sounds really simple, but expressing sincere gratitude to your staff and your team can go a long ways. It's not the end. That's the first step, not the last step. I would say another way to support people is provide as much flexibility as possible. Now, there are some work situations where that may not be possible, right? If you've got nurses and care aides on your team that have to be dealing with people that are sick, they've got to be there for their shift, right? Like that. So there may be a limit to the flexibility, but even within that shift, perhaps you can think about and work with your teams about how do we provide you with a little bit more of a breathing, a break, bit more breathing space, and get creative, right? There's creativity in times of stress is sometimes the hardest time to access it, but it's the time when it's most needed. So if you can't, then engage your team in conversations about, okay, so this is our challenge. What are some possible solutions? And don't rule any of them out right away. Just let that creative energy flow, and explore it. Because often the answer is going to come from that like wild idea that you think at first glance seems like impossible, but with a bit of refinement could actually be quite incredible. Another thing I would say is make sure that you know what supports are available to your team so that you can remind them. Even here at CMHA, we've got an employee and family assistance program, and we remind people of that every chance we get. We remind them of what's in their extended health benefits every chance we get. And we ask the question, and the way that I use it, at least here, is how are you doing? And we remind ourselves as leaders when we ask that for the most part in Western society, we are trained to say, I'm fine. And so we let that answer go and say, yeah, but how are you really doing today? And take that time to just pause and be present with that person and let them express whatever it is they're going through in the moment. Again, it seems like a simple question, and yet the power of it, especially if we don't take that first, I'm fine, right? That society ingrained, this is what the polite response is, right? As Canadians, whether we want to be or not, we're often super polite. And so to stick in that conversation and go a little bit deeper. And then if you're hearing things that are concerning to you or to the person, if you're seeing behaviors that have changed in that person, to let them know what you're hearing or seeing, and to be able to say, and here's some resources for you, right? And if you don't have resources in your company, there's the Crisis Line of BC. Crisis Center of BC has a mental health line that's available 24 hours a day. cmha.bc.ca/COVID, /COVID-19 has resources available on it. And so with a little bit of work, we can all have some resources at our fingertips to help guide our employees to places where they can get more support. As leaders in business and in most nonprofits, we don't necessarily need to be the support for our employees, but if we can help them connect to it, that's a huge step and can be really valuable for our employees.
I've had a follow-up question come through chat, and so it's an interesting one. And it says, just how do you draw the line with too much give? For example, during these times, how do you recognize when you're giving enough to your team versus finding you're being taken advantage of?
Yeah, that's a good question, and I'm not sure it's one that has a single answer. We do have to keep our eyes open for manipulation, right? Hopefully in this time that's not happening very much, but there is a reality to it. I think one of the ways that I look for it is if I've offered resources and the person keeps saying, oh, no, I don't want to connect with any resources, then I'm like, well, okay, that's my boundary as a supervisor, is to say, I'm not your clinician, right? And I'm not actually a clinician by training. So I can connect you to clinical supports and to non-clinical supports, but I can't be that for you. Right? I am your supervisor, and I may have to do performance management, which would be awkward if I was also trying to offer you counseling and support, right? And so it's that that distinction between being friendly but not friends, being supportive but not your sole support, is the line that we try to walk. Yeah, and I would say too, the other thing is if there are performance issues, there are still performance issues. And we may be more flexible in this time of COVID, right? And in a crisis response, but I think it won't do us any good, the organization any good, or really even the person any good if over the long term, if we ignore and don't address what needs to be done, right? Might be done differently in these times. It might be done on a different timeline in these times, but it still needs to be done. And so we need to be clear with our people again that this is what the expectations are, and how do we help you get there? And then if you're not getting there, it's a different conversation.
Yeah, definitely. Great, thank you. So how do you encourage remote and virtual team members to acknowledge and address, we've touched on this a little bit, their own potential mental health challenges during this time? I know that every person is dealing with the stress differently. You joked and said, if you're finding yourself drinking too much, I'm like, I had first, after the first week, I was like, okay, this can't happen every day. So, you know, as long as you have that conversation within yourself, I think you're okay. But I think that, you know, it's easier to do the body language and have that conversation with people when you are in person, and the virtual makes it a little bit harder. And it's, you know, your half an hour call with somebody maybe doesn't express everything. So some tips and tricks maybe for eking out some of those concerns.
Yeah, so I can talk about some of the things we've done that we've heard have worked well from our teams. So we've gone to far more regular team meetings. Usually they're in the morning, and they're usually either half an hour or an hour, depending on the size of the team. And they're either every second day or every day. We've got a couple of teams that are doing it twice a week instead of 3 times a week. But, and at least one of those begins with a check-in that's a personal check-in, not a, like, how's the work going, but a, how are you doing today? Or how are you doing this week? And so we make time for that and space for that. One of the things we found that's important for that is that the leader also checks in and is honest about how they're doing. So on our leadership team, I'm usually the last to check in, and I try to be really honest with my team about how I'm doing. I've had some great days. I've had some days where I was in really foul moods. I've tried to be honest with my team, to make sure that they know that I also have that roller coaster. And because they're actually also a really great source of, like, hey, here's what we're seeing from you and thank you, right? And I try and do the same back to them. The other thing that I do is in my regular one-on-one meetings with my team, I also take time at the beginning to ask how they're doing. And again, try not to fall for the I'm fine response, right? And go a little deeper. So those are some of the things. If you notice change in behavior of one of your employees, let them know that you've noticed it and what about it is concerning, right? So, and that's one of the ways that we know someone may be struggling with their mental wellness, is if we see a change in behavior. As an external person, that's really all that's available to us to notice. And so let them know that you've noticed some change, and leave some room for conversation. They might just say, oh, my dog was acting up this morning and I'm really frustrated. Oh, okay, well, I can understand why you're, a little less tolerant today, or a little less patient today. But they might say, yeah, I've really been struggling with my patients for 2 weeks and I'm in a bad mood, right? And then that's where we can go to making some referrals to some supports. And sometimes all it takes is naming it. It is amazing to me. It always surprises me, and I've been doing this work for over 20 years. And it still amazes me that when I say what I'm feeling, it often, not always, but often takes the edge off that, takes some of the power away from it. And I don't understand why. I wish I did. But I just know sometimes saying it out loud, maybe it's that it gives me the perspective to go, oh yeah, that's just one of my emotions. It's not me. It's not all of who I am. And so, yeah, to just be willing to have those conversations and to reflect back to people what you're seeing in them, as well as those more structured times to check in.
And I think we were discussing it amongst the chamber CEOs, EDs the other day. Everybody was giving me a hard time. I took Friday off. And my out of office actually said that I would not be checking or responding to emails until my return on Monday. And I literally I shut off notifications off my phone. I just took the day to enjoy with my dog. I went and ran some errands. I didn't do anything special. I didn't go anywhere, but I just took the day. And it really, I woke up Saturday morning and felt like a whole new person. But some of my counterparts were giving me a hard time. You took a Friday off? Like what? And I went, be careful with that, you guys, because if your team see you going over that line and started to get stressed, if what it takes, if it takes you going away for a couple of days, or if it takes you taking an afternoon, or go for a round of golf, whatever it takes for yourself, make sure you take that time for yourself as well as allotting it for your team. I know that I've sort of stressed all of my team lately is, yes, we're not really going on vacations right now, but you all have some time owing. Take a day here and there, take a couple of days, walk away from it and refresh. So, and no harm in that. And it's not to be shameful about, enjoy it.
Yeah, no, and that's a very good point. I think one of the things we know is when you're, when you take time off, it should be off, right? That's how we recharge. And the evidence, the literature is really clear on this. And we need to role model that as leaders, right? So when I go on vacation, my out of office always says, I am not checking emails or voicemails, and here's who to contact if you need immediate response. And as much as possible, I stick to that. And there are a few times when I haven't been able to do that, but I tried to be explicit with my team about why I'm not doing that in this time. And I'm taking next week off. One of the things that's important to acknowledge is any disaster response, especially the response to the pandemic, is a marathon. It's not a sprint. This response could last 12 to 18 to 24 months. If we think any of us can be working full on all day, every day for 24 months, you're going to be in trouble at the end of it.
Yeah.
You are going to suffer.
Or probably midway.
Oh, yes. Yeah, I was going to say, if you get all the way to the end.
If you don't hit a burnout point midway, you'd be in trouble.
Yeah, and that's not good for our organizations if leaders are in burnout, right? Yeah. So, and if we're in burnout, probably our staff are, right? Or at the very least, we're role modeling that's our expectation. Whether it truly is our expectation or not, it's what our behavior communicates. Yeah. So the importance of saying, just take days off, take your vacation, even if you can't go on that trip we were planning, take the time to take care of yourself. It's time, one of the things I always say, it's time that's owed to us. It is, it's part of our employment agreement, and part of our compensation is to get some of that time off, to take care of ourselves, so that when we come back, we're more engaged again, we're more focused, and we do our jobs better than if we didn't take the time off.
I agree. So this was one of my questions that I snuck into the mix myself, looking for suggestions on balancing mental health in the workplace, employee needs and wants, and work-safe rules.
Yeah, well, I in some ways, I wish I had an answer for all of this. And partly because our workplaces are so different. There is no one solution to this, and our employees are so different, right? So I think what it comes down to for me is discussion, is having conversations about this, to find out where that balance is for your industry and organization, and for your specific group of employees, and for yourself. Some of it, the WorkSafe BC rules, like that's a bit less negotiable, right? What's important is that people have a common understanding of the rules, and work to find ways to make them work in the specific work location they're in. In terms of the mental health in the workplace and employee needs, That's much more of a conversation. Sometimes it's about getting creative. I think my learnings from this pandemic is that we can be way more flexible in our workplace and still get the work done than I had ever thought. Right? If you had asked me 2 years ago, could a parent work from home and work 3 or 4 hours in the morning before their child was awake, and then 3 or 4 hours in the afternoon when their kid was napping? I probably would have been like, no. And yet we've had to during this pandemic, and the work still got done. So, being open to that, let's try something new, put in measures in place to evaluate it and to see if it's working. And if it is working, then say, okay, is this meeting your needs and our needs? Okay, then maybe that's okay. Keeping in mind collective agreement rules and all that kind of other stuff, right? But also on the flip side of that, if the evaluation shows that it hasn't worked for either side, then to go back to the drawing board and say, okay, what's another way that might work? I'm sorry, I want to use the word the gift of the pandemic has been that we've had to be creative like that. And I think that's at least shown me, and I think others, that it's possible.
I agree.
Different arrangements have worked, right? And I hesitate calling a crisis or saying a gift has come out of a crisis, but I think at very least it's a learning for us that we can take forward. One of the things I talk about with our staff is none of us chose to have this pandemic hit us, but as we come out of it, we get to make choices about how we're going to be going forward and how we want to be in the world going forward. And I think that's one of the learnings for me that I'm choosing to take out of this is that we can be more flexible than we thought, and the work can still get done. There's some places where we probably can. Again, I go back to the example of if you're working in a care home, there's people have to be in the care home, right? But maybe there's flexibility in the duties they do and how it gets scheduled, right? And then in places where there's more flexibility, you can exercise that and test out. I'm a big fan of try something. If it doesn't work, just acknowledge that didn't work, and then figure out what parts of it didn't work so that you can make some adaptations and try again. If after a few attempts none of it works, you might need to say, okay, well, we tried. Let's go back to how it was.
No, that makes sense. So how would you balance, and again, I'll come back to virtual working, where when you're in the workplace, conversations are very clear, things are more, processes are a bit easier, body language, conversations, team meetings. Mm-hmm. How would you balance inter-employee relations while working from home? Side chats, misinformation amongst team. The boss says one thing and all employees interpret it differently, and sort of start getting that little bit of dissension in the ranks in the background. Over the years, I find it's easier to deal with that in office, but now, how have
we done that? Yeah. So in terms of the side chats, one of the things I've read and that I try, and I must say it's probably not my strongest strength, but is to leave a bit of space at the beginning of those meetings for that informal chit chat. Maybe as the boss, join a couple minutes late intentionally so that people are chatting with one another, right? If you're the leader, because that's invaluable, right? That informal conversation, it's often where big things are thought of or tripped upon, right? That can then be brought into more formal conversations. So that's one way, and I think acknowledging that we're not having the hallway conversations, right, or the water cooler conversations that we used to. I think things like you had talked about having a virtual dinner. I know one of our teams has done a few times a virtual no talent show, just to have fun with one another, and they do it on Zoom and they show each other the pandemic skills they're learning, right? The new hobbies or skills that they're trying to teach themselves during the pandemic. Fun, informal. They made it optional for their team, but everyone attended. So that, again, that creativity of how to engage in different ways. One of my colleagues does a virtual happy hour once a week with their team. It's optional, and what beverage you drink is totally up to you. In it, it's after hours, and no one asks what you're drinking. So just some creative ways to get that social interaction still happening. And then in terms of the potential for miscommunication, this is high all the time. And I think in this time, like before the pandemic, we would usually hear it in the hallways, or someone would come to us afterwards and say, like, I don't know what you thought you were saying, but this is what we heard, right? Those people that trust you and, will be your informants about how things land. And those don't happen as easily in this time. And so I think as leaders, we need to seek it out, to talk to our colleagues, like the people on our team, our immediate team, to say, what feedback have you heard from that meeting? How did that land with people? And it's important to have built the trust that they can be honest with you about that. And then also, and not maybe just your immediate team, but also, we all should have allies at all levels of the organization that we can trust and reach out to and just say, hey, I'd love to hear some feedback about this, right? And how it landed. So that's one of the ways, and just to acknowledge again, it is harder during these times. So also a good idea to communicate in various mediums. So, you may say it in a Zoom all staff meeting, and then follow it up with an email. And then if you have a staff newsletter, maybe talk about it in the staff newsletter. I once worked for a program where we had lots of customers, and one of the things we always said was, until we had said it 4 times, we hadn't said it. I recently worked with an executive coach, and I made this comment one day, like, I'm sick of saying this. I feel like it's all I say. And he looked at me and said, oh, good, then you've almost said it enough. And every time we say it, that's an opportunity to clarify, right? So those are maybe some tips and tricks. Again, there's no silver bullet for it, right? Yeah.
So still dealing with sort of the employee question, the unknown, as we've talked about a little bit, we're in a pandemic. You acknowledged this isn't, September 1 isn't the date the pandemic's over and we go back to normalcy or whatever normal looks like. Yeah. We are still hearing second wave, even though we've done, British Columbia, we have done an amazing job, and I'm blessed for where I live and thankful for it every moment that somebody hired Dr. Bonnie, and whoever did deserves a gold medal. And I think that, we have to be aware that there is possibly and going to be a second wave of this, when it hits and what we don't know. Again, that's the unknown. I know that when I've been looking at, and you mentioned it as well, as an organization, usually we have a 3 to 5 year plan. Right now, it's a 3-month plan. You kind of shorten it down to 3 months and kind of break it off into chunks and say the caveat is this could change at any time. And again, that honesty. But when you're looking at dates of return and second waves and all of that unknown, and trying not to create another level of anxiety for your team. So again, I'm searching out some ideas. I'm blessed. My team has been really, and I've been open with them the whole time. And if they ask me a point blank question, and if I don't have an answer, I go, I'm sorry, I don't know, but I'm going to work on that for you. So how would you advise some people looking at the next steps?
Yeah. I think a number of things that I want to touch on. The first is giving people a model can help. If they can kind of hang their hat on a few things, that can be helpful. So earlier I talked about disaster response as a separate phase, but overlapping with disaster recovery. And so we talked about that with our staff. And in disaster response, for the most part, the response is about preventing any further harm, right? Minimizing any harm, preventing further harm, and just stabilizing the situation. And I think that's what we've seen from March until a couple of weeks ago, right? It was just all the focus, none of it was long-term, right? We're not talking about phase 1, 2, 3 in March. We were talking about how do we save lives right now, right here. And so to let people know, that's what's needed in a disaster response or in a pandemic response at the very beginning. Is just focus, keep people as safe as we can, minimize the damage, and keep things running, right? I even said to my board early on, during the response phase, I cannot worry about how we're paying for this. We are going to do what is needed to keep our people safe, to keep our services flowing to the people we're here to serve. And I will figure out how to pay for it later. And I must say, it was one of the most anxiety-inducing conversations I've ever had with my board. And thankfully, the treasurer of our board said, Michael, that's what's needed right now. And by the way, can I take that back to my organization?
Yeah.
Right? And I'm like, okay. Because really response really is about mitigating any further damage and keeping people as safe as possible. And whatever that takes is what it takes. Recovery is how do we want to be going out of this, growing out of this. And like I said, those overlap. So it's not this like response is done this day, recovery starts the next, right? I wish it was that clean.
No.
But it depends both on the individual. Some people move through that threat phase faster than others. And it depends on the community. Some communities seem to move through it faster or slower than others. And it depends on what it is we're responding to. So in a forest fire, it may last a week or 2 or 2 months, but we know it's not going to last forever. And when the fire's out, the danger's gone, right? This pandemic is different. We don't know for sure when the threat's going to be over, and it might, as you mentioned, come in waves, right? Where we've got periods where we think we're pretty okay, and then, oh my God, all of a sudden there's more cases, and we feel more threatened, and God forbid, maybe the healthcare system's more overwhelmed. And so that's very different than we're used to, and that's one of the reasons there is no playbook. Nobody alive has gone through what we're going through, and so we're in some ways all making it up as we go, and we can draw on that disaster response and recovery mode. So the recovery piece is the time we get to make the choices about how we want to be in the new world, right? Now that our world's been disrupted, what are the choices we're going to make about how to be in the new world? And so, we can see some of them, right? Like we're getting plexiglass barriers in far more places than we did. I hope some bigger changes come out of it. Like, I think we need to rethink how we take care of our elders. And I think that, one of the things that disaster does is shine light on the cracks, right? Partly the nature of this virus and partly the nature of our care system, right? There's cracks that have been highlighted by this response and this virus. I think how we engage all people in society and make sure that we minimize the number of people excluded from our social supports and our societal supports, because those have been cracks, right? If some of the information coming out of the United States is that people of color have been impacted far greater than Caucasian people. So all of that lead us to some choices we can make, and I hope we start to make in that recovery phase. I have been asked, how do you know when you're moving from the response to the recovery phase? And again, I attribute this to my time at the Red Cross, having learned this is in response, for the most part, people are just glad that someone is doing anything to keep them safe, or that anyone is doing anything to keep them safe. And there's a lot of tolerance for changing minds, for changing directions. There's rarely much questioning of the leadership in a response. It's just, thank goodness someone is doing it, right? As we move into recovery, people start questioning all the decisions that were made in the response. And they tend to forget that the decisions were made with the best information available at the moment because they have all this new information, right? They're like, well, they shouldn't have said this, that, or the other thing. Well, in that moment, it probably was the best advice. Looking back, yeah, we have new information and thought. But so when that questioning starts to surface, when there's that starting to be pushback about direction and decisions and changing decisions, that for me is a sign when we're starting to move into recovery. And again, as a leader, that can be really challenging because suddenly all of your decisions for the last couple of months are under a microscope, and it can feel really personal. Speaking personally, it can feel like someone's challenging every decision I have made. And for me, it's helpful to have that frame of, oh, right, okay, we're moving into a new phase. Okay, so now recovery. How do we want to be? What choices do we want to make long term? So that's one way to help people with the unknown, is to say, like, there is this natural progression, right? You may not like it, but it's going to happen. I think the other thing is to acknowledge that we are in a time of unknowing, and to make it as okay as possible to be an unknowing. So it's not only is it okay, it's vital to say, like you did, I don't know. When we don't have the answers, don't make it up. In a disaster response, because our lives are threatened, our bullshit meters are high. And if you lie about something or make something up, people are going to know. So far better, and then that'll erode trust, right? So if you don't know, far better to say, I don't know that. And if you can, say, but how do we find that out together? Or to say, like you did, but I'm going to work on that. I'm going to find out, and I'll get back to you on that. Again, as leaders, I think we often fall into the trap of thinking we need to know it all. But the reality is none of us can. And the reality, especially right now, none of us know what we're doing, right? I think maybe Bonnie Henry, but I think even Bonnie Henry has admitted, like, although she trained her whole life for this, this was unlike anything she expected, right? And again, that transparency and that honesty of, like, I know what I know, but I know that I don't know this, I think helped build trust. And I have to say, you know, Bonnie Henry over this has become one of my new heroes in terms of leadership and communication. Again, I'm sure not everything she did was perfect, but she was there with us. She communicated clearly, honestly. She let us into her world a little bit. It hurt her to know so many people were dying, right? So I have such respect for her and handled it. And she's led us through it. She's prepared us for different things and led us up to them. And then when she wasn't able to, was like, whole bunch of new information that we learned overnight. Wow, we're surprised too, right? So just I have such respect for how she's handled this and how she's talked about it. And even then with the reopening, she started signaling to us that it would be coming, right? Here's some things you can do to get ready. Oh, now we're in phase 1, right? Here are some things that you can do to get ready for phase 2. Now we're in phase 2. And again, not a perfect transition into recovery, but it never is.
And I think the line too from her that's really, for me, has been kind of always in the back of my mind is, it's just for now, not forever.
Yes. 2 lines for me, that one, and be kind, be calm, and be safe.
Yeah.
And one of the things that struck me about that is that the be kind and be calm was before be safe.
Yeah.
And for me, when we're panicked, we make bad decisions.
Oh,
And so I realized in thinking it over the last few months, like that be safe is at the end, I think really on purpose.
yeah,
Because we need to be kind, we need to be calm in order to be safe.
yeah.
And, so those two phrases, for now, not forever, and be kind, be calm, be safe, they,
We need t-shirts.
yes, yeah. Yeah, well, and Fluva did shoes with the
I
be kind,
didn't get them.
I know, I tried to
I
get some
know,
to my sister, and I
I know
didn't.
2 people that did get them, but I didn't get them. I would like to, we were approaching time, so I just want to be respectful of everybody's time, including yours, and say thank you very much. That goes through our list of questions. We do have a couple of minutes left. If anybody has another question, they can throw it into the chat box, and I'll be sure to get that through. But Michael, before we go, I just want to say thank you very, very much for your leadership through this, not just for your organization, but as you had mentioned before, we're not the first chamber that you've spoken with and reaching out. And I think during this time, again, just having that conversation and being able to listen to somebody, and I think for myself that the overanalyzing conversations you say that we had with ourselves sometimes, and I in my board meeting yesterday, I turned to someone and I said, they went, well, how are we going to do this going forward? And I said, I don't know. I don't have the answer for that. I'm actually coming to you for some advice and leadership as the board members. And they went, oh, okay. Because they're so used to me having the answer. But I just went, because I said, my reasoning for that is I'm going from A to B to C to D, because I've got all these suggestions and ideas. And I'm honestly looking at them going, this is a good point. That's a good point. Where do you, where's the answer? And they were like, ooh, if you don't know, how are we supposed to know? And I said, and that's why we're going to strike a committee.
More minds are better.
Exactly. Sometimes you just need a whole bunch of people to throw something at the wall and hope for the best there. A couple of people had to log off early, and they did send me quick emails, so saying thank you, that this has been fantastic, and they really appreciated your time as well. Alexandra just mentioned that she also, thank you very much. This was a great, and you're more than welcome. I'm glad we could help out. Michael, thank you so much again. And I personally took about 7 or 8 little nuggets away from today that hopefully I can use with my team. They'll be able to give you some feedback later and let you know how it was, because she's on the call. So one of them. Thank you so much for coming out today. I really, really appreciate it. Thank you to everybody for coming out. And I do ask those that are attending, take a look at our other events coming up. There's a whole bunch of information there, some educational, some inspirational, and some informative. So hopefully you can join us soon. Thanks very much, Michael.
Great, thank you so much.